Welcome back to the Empowered Minds podcast. I'm your host, Nathalie Bedrossian, high performance coach and aspiring speaker. So, as you guys know on this podcast, we cover a range of topics from peak performance to habits to sleep, nutrition, mental health. And today's topic is actually with a very special guest, Dr. Vanessa Mahseredjian. And she is going actually to talk about the use of stimulants when it comes to performance. So she's actually a pharmacist and she's here to share all her knowledge with you guys. So welcome, Vanessa.
Thank you for having me.
Thank you so much for being here. So tell our listeners a little bit about you.
Yes.
Where did you start? How did you get to what you're doing right now?
Yes.
Tell us a little bit about that.
Yes. So for those of you who don't know me, my name is Vanessa. I'm Armenian, born and raised in Canada. I am a practicing pharmacist in the Great Montreal area. I completed my studies in University Laval in 2021 and have been practicing as a pharmacist ever since then. I have worked in a medical clinic as a consulting pharmacist, so working with doctors, nurses, patients, and I currently work in community pharmacies. I also have a great passion for health and wellness, which is why I started my social media account.
Yes.
It's mainly dedicated for patient education, but also helping to give you guys tips on how to optimize your health and wellness.
Yes, actually, everything will be in the description. So the link to her Instagram page, so you guys can follow her and learn a lot from everything that she does and shares.
Yes.
So how did you actually decide that you wanted to be a pharmacist? Was it a process? Was it something that you always knew?
So it was definitely a process. I always knew that I wanted to be in healthcare. I always had a passion for it, for helping people. But I obviously, it was a process for me.
Yeah.
I really wanted to work closely with patients.
Yeah.
As a pharmacist, you are a first line healthcare provider. So the first go-to person when people have questions. And I really like the interpersonal relationship I have with my patients. So that's one of the reasons why I chose pharmacy.
Nice.
And I also like, I've always been good in chemistry as well. So medication treatment is also very interesting for me as well.
Yes.
So combining the both is why I chose pharmacy.
Absolutely. That's really interesting, because some people they don't always have that answer in their minds. Like it's a bit wavy, their path is not always straight. So did you directly get into pharmacy after CJEP here or after high school, or did you have to take different path to get there?
So I obviously went to high school, college, and then I did a year in biology in University of Montreal.
Okay.
And then after that, kind of deciding what I wanted to do, it was definitely a process, like I said,
like a lot of people.
Yeah. Because I feel like we're so young when we have to decide what we have to do for the rest of our lives.
Yeah.
So it's really important to take that decision because it's something that you're gonna do for the rest of your life. So you have to make sure that it's something you're passionate about, something you love doing. So after my year in biology, I got accepted in pharmacy in University Laval. So for those who don't know, it's in Quebec. Yes. So it's a 4-year program. So 3 years I was doing back and forth Montreal, Quebec. Coming to see my family.
It's 3 hours, right?
Yeah. And then going to school on the weekdays, coming to see my family on the weekend. And then my 4th year was all my internships. And yeah, that was my pharmacy process.
That's awesome. That's really interesting. And I'm curious, actually, I probably ask this to everyone I know that's in a very high contingent program, whether it's medicine, pharmacy, dentistry. Are you happy? Does it meet your expectations? Because it's a lot of hard work. And now that you're actually in the workforce, in the workplace, does it meet your expectations? Are you actually happy with what you do?
So that's a very good question. I feel like what they teach you in school is not necessarily the same thing as real life. So in school, they do teach you all the knowledge you need to have as a pharmacist and how to be a good pharmacist. But it's really when you go into the workplace, that first transitional year is always a little bit difficult because you kind of realize what you learned in school and what is real life is not always the same. But I am very happy. I know that I'm very happy in my decision. the first year, like I said, it was like an adaptation period for me, trying to navigate, okay, what I learned in school and then what is in real life and how to kind of have the balance of both.
Yes.
And now I feel like I have a pretty good balance. And yeah, it's the first, I would say the first few years is always the most difficult or rocky. But if you know that what you're doing is what you've always wanted to do, or you have a passion for it, at the end of the day, it's always worth it.
It's worth
Yes.
it. It's worth the effort.
Yes.
It's worth the whole work.
For
right?
sure.
Maybe we'll have another like full episode on how you got into pharmacy in a
100%.
highly contingent program.
100%.
I'm sure it would be super beneficial to
Yes.
a lot of students who really want to get into pharmacy and these very contingent programs. So,
Yes.
topic of today, stimulants and performance. So can you tell our listeners, tell our audience a little bit about what they are, so what stimulants are, and what are they most commonly used for?
Okay, so that's a good question. So stimulants is a very general term. So generally what stimulants do, they speed up the message between your brain and your body. So they increase alertness, awareness, focus, energy. So some stimulants do include caffeine, nicotine, and then we also have what we call the psychostimulants, which are better known as performance enhancers, which are generally prescribed for people who suffer from ADD or ADHD, which is attention deficit hyperactivity disorder.
Yes. So they're mostly used in a prescribed, let's say if we kind of leave out the caffeine, nicotine, the psychostimulants are mostly the ones that are prescribed, let's say in a medical situation, a medical context.
Exactly.
And in terms of prevalence, so how many people are actually prescribed stimulants? What's the prevalence of it? What's the percentage of the population that actually uses stimulants?
Yeah. So what's very interesting is that in most recent studies show that there has been an increase in ADHD diagnosis. Okay, so there could be multiple reasons for this. I do think that it might be because we have more access to tools to diagnose it. People are more aware of it. Yeah. It wasn't. There's also less of a stigma around ADHD nowadays. But there is also an increase of, like I said, diagnosis of ADHD. So we're talking approximately 4 to 6% of Canadian adults that are affected by ADHD, and then 5 to 7% of Canadian children that are affected with ADHD as well. So that's approximately 1.8 million Canadians, which is a lot. There is also an increase of use of non-medically prescribed stimulants within university, college students. So the motive being most of the time to increase academic performance. You know, these people are subject to a lot of stress, a lot of, they want to have good grades, get into programs. So they resort to these kinds of treatments to kind of increase their performance as well.
Yeah, definitely. And it could definitely get dangerous that, using these technically medication that has to be prescribed in a non-medical context, right? What are the, let's say, the downfalls of using stimulants, psychostimulants more specifically in these contexts?
So the use of stimulants has to be carefully monitored by a healthcare professional because misuse or overuse, even for a short period of time, can potentially cause very harmful risks. So with certain people, it can cause paranoia, psychosis. If you're susceptible for this, meaning people who are already suffering from schizophrenia, have mood disorders, bipolar disorder, and then it can also, in more severe cases, cause heart problems, such as increasing your heart rate, abnormally increasing or lowering your blood pressure, and sometimes even heart attack, which can be fatal. So again, I reiterate the importance of using these medications. It has to be used in a medical setting. It has to be always monitored carefully by a healthcare provider, whether it's a doctor, a pharmacist, or a nurse.
Absolutely. And I really, really agree with you because, yes, you might see other people using it. You might see people encouraging you to use it, but it doesn't mean that you will react well to it,
and
right?
it's not indicated for everybody.
And it's not indicated for every. Some people get prescribed these drugs because the doctor knows their situation, knows, their body, all of that. So it's not prescribed for another person, whether it's the dosage, whether anything, right? So it's super, super important to be careful with the consumption.
And even some people that have like a very severe case of anxiety, these psychostimulants can actually increase your anxiety. So that's why it depends on each person, on your health situation, and this is why it's very important that this treatment be monitored by a healthcare provider at all times.
Absolutely. It's super important. Again, anxiety, because you're already kind of tensed up, you're already feeling stress, and a stimulant is just going to get that times 10, right? So it's very, very important to consume it only when it's prescribed, and consult with your pharmacist, with your doctor, and make sure that you do it well. I have a couple of stats actually here. So they date from 2019, but I was actually shocked, in a way that most of the stimulants are used from let's say kids, youth aged from 15 to 24, and 15 to 19 specifically, they use it for 5%, and then 20 to 24, which is what, let's say, most students are aged, right? It's 9% are actually prescribed or use stimulants. And of these 9%, 5% actually develop eventually problems with it, whether it's misuse, overuse, addiction. It could lead to addiction too, right? Because
that's one of the, actually, it's like, like it's an opening. You start with that, and it can lead to other things,
and
unfortunately.
It could lead to use of other drugs, other things too. And another thing that we also didn't mention is that people who, let's say, take these drugs and use them over time, eventually develop an addiction. And after that, when you want to get out of it, or maybe decrease the dosage or decrease your use, you can go into withdrawal, which could lead to depression, could lead to fatigue, could lead to all the opposite effects that you want, right? And in the end, in academia, it's definitely going to affect your performance and in other areas of your life too. So use it wisely. Make sure that you consult with a doctor, pharmacist.
Always.
Yes. Excellent. So, other than that, is there any other information or safeguards that you'd want to share with students, especially in university, with regards to the use of stimulants?
For sure. So in pharmacy, a common saying that we have is start low and go slow when it comes to medication dosing. So we always, and this is specifically true for stimulants, we always start with a low initial dose, and then we increase it gradually depending on the person's response to the medication. If they're having side effects with it, then we decrease the dose, or if the medication is just not working for them, then we change the treatment. Again, I reiterate the importance of working closely with a healthcare provider to help guide you, to help figure out what your therapy goals are, and we can adjust your treatment accordingly.
Yeah, absolutely. And another thing that you mentioned actually at first, talking about coffee.
Yes.
Right. Personally, I really love coffee. I love to consume coffee.
Yeah.
And a lot of people have a lot to say, a lot of different things. You hear nutritionists, naturopaths, and different things about coffee. What are your thoughts on it specifically?
So I am a consumer of coffee as well. So, I mean, there isn't any conclusive studies if coffee is good or coffee is bad. Obviously, we say to try to limit the caffeine intake to 4,000 milligrams a day, which is about 4 cups of coffee. Personally, I do think that 4 is a lot.
That's what I was
Yes,
gonna say.
It is a lot.
It does seem like
it is a lot. And what I generally try to do is have 1 cup in the morning to help get me through the day. Obviously, with coffee, you have a peak and a crash.
Yes, you have that
and
crash.
You try to take your caffeine as early as possible in the morning. You obviously don't want to have that crash in the afternoon, where generally your body already tends to be a little bit more fatigued in the late afternoon, and having the coffee crash can be detrimental, especially if for students that are they want to perform well in school. So that's very important. But their coffee is not bad. It's just you need to know how to use it. Exactly. And you need to understand your body, because there's not one special formula that works for everybody. Like everybody reacts differently to coffee. Again, coffee is a stimulant, right? Yeah. So people who are already more susceptible to having anxiety disorder, well, for them, maybe they would react a little bit more than someone who doesn't. Exactly. So maybe those people, for them, coffee doesn't work. And then also some people do have digestive issues with coffee, because coffee can also irritate your stomach. So that's why we have to kind of understand our body and know what works for us.
Absolutely, absolutely. So know exactly what works for you. And there's actually... and I don't know, have you heard about Dr. Andrew Huberman? No. Yes. Well, I learned a lot from him. I really do listen to his podcast, and he gives a lot of, tips on health based on evidence-based tips. So what he said about coffee, because I always used to have the afternoon crash. I would take coffee as soon as I wake up, and then the afternoon I would just, crash. Have that big crash. So what he says, and that specifically worked for me, and you guys can try it out, see if it works for you too. You can maybe try it out too.
Yes, I will.
If you have that afternoon crash. So what he explains is that, let's say, like during your day, you have this molecule that builds up. So when the night comes, you have a big buildup of this molecule, and it makes you fall asleep. And then during the night, the doses of this molecule decrease. It's called adenosine. So when it decreases, let's say you wake up and there's still some adenosine left in your body, because let's say you didn't have a good night of sleep, you're tired in the morning, and you take that coffee. So what that coffee is going to do is that it's going to block the receptors in your body of that molecule. So you're going to have that little peak, but then once the coffee wears off, there's still some adenosine in your body, and that's why you experience the crash right away, right? So he recommends actually to wait 60 to 90 minutes after you wake up, just to make sure that there's no more adenosine in your body, and that could prevent the afternoon crash. So maybe waiting, that worked for me. I've tried it, still do it now. So I do wait a little bit before consuming my first cup of coffee, and it has helped with
I'm definitely going to give that a try.
Yes.
I also don't recommend having coffee on an empty stomach.
Oh yeah, that's
not a good idea. That's not a good idea.
Absolutely. So, we covered how many people use stimulants. We covered the risks, side effects, to always be careful. Yeah. Now, are there any alternatives to stimulants, maybe more natural ways to increase productivity, to enhance focus when it comes, again, to students?
So to this day, for people who are suffering from ADHD, the most effective treatment is proven to be medication treatment, okay? However, it's very important to understand that medication treatment is not the only thing. It is very important to combine this with what we call in the healthcare world cognitive behavioral therapy, so CBT. Yes. Okay. So there's many other things that we can do as well. So we can create a routine. So waking up at the same time, sleeping at the same time helps your body kind of stay organized. And also staying organized, you can have a calendar to plan your tasks ahead, have a to-do list as well. Also managing your distraction. So understand what distracts you. Also kind of trying to avoid it when you're having to be focused, working or studying. Background noise, white noise can also help. Yes. And also a very important one is your lifestyle choices. So as a healthcare provider, I really advocate for healthy lifestyle. I feel like it's very important and it's often underestimated of how important it could be. Yeah. So making sure that you're eating nutritious food, that you're exercising, being physically active, and most importantly, sleep. Sleep is very important, especially if you have ADHD, because if you're not sleeping well enough, if the quality or quantity of your sleep is not good, then it can also make your ADHD symptoms worse.
Absolutely. You touched on a really, really good point there, because like, yes, medication can fix a lot, but let's say you only get medicated, but you don't do CBT, or you don't, pay attention to your lifestyle. Like, it's just going to counteract all the benefits that you're getting from the medication.
It's like taking, honestly, if you're not doing if you're not treating the root of the problem, if you're not looking at your lifestyle choices, just taking the medication, it's you're taking it for nothing. It's you have to do the work as well.
Yes.
But the medication treatment for the ADHD, like I said, if you have ADHD, diagnosed ADHD, it's the most effective, but you have to combine this with CBT as well.
Yes. And other types of behaviors too, which
Yes.
I actually wanted to talk about, the state of flow. Have you heard of the concept?
No.
So it's mostly in the context of like performance sports, Olympics, all of that.
Yeah.
And the concept really comes from the psychologist. I really don't want to butcher his name, but his name is Mihaly Csikszentmihalyi. Hopefully that was right. We'll see. Let me know. But in his book, Flow, The Psychology of Optimal Experience, he really talks about this concept of flow. And here's how he defines it. So it's the state in which people are so involved in an activity that nothing else seems to matter. The experience itself is so enjoyable that people will do it even at a great cost for the sheer sake of doing it, right? Think about any sport that you're doing. You're just in the moment. You're doing the sport. Like really skiing comes to mind.
Yeah.
And let's say you're just skiing, you're going down. Like, are you really thinking about what are you going to eat tonight?
No.
Are you really thinking about, I don't know, all your life problems? No, you're really in the moment. You're focusing on the slope. You're really going and you're really in the moment, right? This is a state of extreme focus. So you're really taken by this experience that you're living in. It's not only applicable in the context of sports, but it can actually be applied to your studies, to studying and doing basically any activity, cooking. It can really be applied to any other context of a person's life. So, characteristics of this situation really include, like I mentioned, complete concentration on the task. You have a clear goal in mind, right? Like, again, if I take skiing, your goal is to, let's say, go down the slope, not fall.
Yeah.
Maybe you want to do some maneuvers here and there. So you have a clear goal in mind. And time, strangely, passes in a strange way, right? Have you ever been, let's say, I don't know, working on something, a project that you love, and you just don't see time pass?
Oh, for sure.
It flies like this.
For sure.
This is something. This is also a characteristic of, it means you're most probably in a flow state. You're just so absorbed by this task that you're doing. So it also, has to be something you love, right?
For sure.
That you love doing. There's like this effortlessness. And one interesting thing about it is that there has to be a kind of similarity or balance between your level of skill and how challenging the task is, right? Because if it's too challenging, you're not gonna be
stimulating enough.
Exactly. And if the task is not challenging enough, you're just gonna be bored. You're not gonna be stimulated enough. So there has to be that balance too.
Yeah.
And you guys, there are definitely things that you can do to get yourself into that flow state. So one of them, for example, is to maybe create a pre-flow routine. That's how I call it, a pre-flow routine. So you have something consistent that you do that triggers your brain to be like, okay, flow is coming, right? So it's something that you do repeatedly. So obviously clean your environment. And sidetracking here, but I saw this, I read this article recently that it said that even if you leave your phone on the table, even if you're not using it, it still takes up brain juice. It still takes up some of your energy, even if you're not actively using it. So just put it away completely, make sure you work in a clear environment, no noise. You can also put some music, obviously not the pop or rap or anything like that, but something more relaxed that could get you in that state. So obviously pick a task that's challenging enough, not too challenging, but that could at least stimulate you to some certain degree. It has to be something you love, and give yourself enough time. So it has to be at least from 60 to 90 minutes, right? You're not going to get into the state if you're just having a 20-minute study session or if you're having a 20-minute activity. You really have to give yourself some time to get into it. So again, these are just quick tips. Try it out. But again, it's not a one size fits all formula. It's always adaptable, and you have to also know yourself and know what works for you too. So that's just another way, again, without using stimulants, to get yourself concentrated, to get yourself focused. So there's a lot of tools out there. Again, and I don't know what you think about this, but I feel like, do you feel like we live in an over medicated society where medication is always the quick fix? Or because I feel like, to me personally, it's probably like a last resort thing, right? You always try habits, lifestyle, methods that don't require medication, right? Like flow or anything like that. But do you feel like people just want the quick fix, and that we live in this society where it's so accessible that they just go for that instead of actually working on themselves?
So that's a very interesting question, actually. So I do feel like medication can be used as a quick fix if it's used inappropriately, if it's misused. Again, over relying on medication solely and not addressing other health factors can be problematic.
Yep.
On the other hand, I do feel like medication has revolutionized the healthcare system. It has greatly improved the quality of life for a lot of people, treating from chronic diseases to infectious diseases. But again, it has to be used appropriately. We have to really treat the root of the problem and not just manage the symptoms. That's where it becomes a problem. And as a healthcare provider, I really do advocate for a holistic approach. So really just looking at the person as a whole. So most of the time when people come to me, for just an example, I'm going off subject.
It's okay.
So when they come to me and they tell me, I can't sleep, I don't know what to do, like, what should I take? What should I do?
Yeah.
My first question that I asked them, why are you not able to sleep? Are you anxious? Are you stressed? Did you experience lifestyle changes recently? There's a lot of factors when it comes to sleeping troubles. Are you suffering from breathing issues?
Yes.
So again, it's really treating the root of the problem, and again, looking at our health choices that we're making, like we talked about earlier, making sure that we're eating the right things, that we're moving, we're active, and just making sure that our overall mental and physical health is in check.
Yeah, absolutely. You're very right. Because it's so funny to me that you said, when people come to me, they're like, I have trouble sleeping. What should I take?
Yeah, because
right?
it's a very vague subject that you would be surprised how many times I get this question, and I get it. Because again, like sleep, you're not sleeping well, you can't function. If your sleep is not okay, your mental and physical health will follow as well.
Absolutely.
And I get why they come to me with this question, but it's such a complex answer. There's not one answer. It's really understanding why you can't sleep, and really just addressing the root of the problem.
Absolutely. So let's say the main point here is to actually, before even resorting to medication or to, let's say, more extreme measures, always look at your lifestyle, make sure that your sleep is in check, you're working out, you're doing all that. And then if you take care of all of that and you still have trouble focusing, then maybe it's ADHD, maybe it's, more profound issues or problems that you need to fix that could be fixed better and could improve your quality of life with medication, with other forms of therapy like CBT.
Exactly.
So always look at your lifestyle first. But again, to me, I might be wrong. I don't think there's a black or white answer.
It's a very gray zone. Yes,
it's definitely a gray zone. To say that, as a population, are we over medicated? It's definitely a thought that I've had, that I kind of question myself sometimes.
Yeah.
But again, to me personally, I do try to limit my medication in general. Probably extreme even, even if I have pain, simple as period cramps, right?
Yeah.
I don't use Advil, Tylenol, all of that. I try to go as natural as possible, but then in more extreme cases, medication is it's a must, right?
Yeah.
You can't just completely leave medication out of your life.
Exactly. It's not about vilifying medication. It's understanding its function and understanding that you have to do your job in terms of all the other things in your life. But sometimes it's necessary. Sometimes things might be out of your control as well. It's just to make sure that the things that you can control, that you are controlling, and then the things that you can't control, that's where we're here to help.
Absolutely. Absolutely. And make sure you use it right too, that you get the help.
Exactly.
And not just, take something off the street or just
100%.
because someone gave it to you and it worked for them, right? It might not be the case for you.
And it's actually important to note that ADHD, it's not just a simple diagnosis. Like when you go to see your doctor, it's really multidisciplinary, like a diagnosis that they make. So it's working with your doctor, with your neuropsychologist. Like they really evaluate and well, that's what you're supposed to do. Yeah. It's not just an easy diagnosis. Oh, you're having trouble concentrating, you have ADHD. Like there's multiple facets and aspects to the diagnosis as well.
It takes time. Like it's not, I saw you for 1 hour. Oh, you have ADHD.
No.
Again, I feel a lot of people misuse that word too.
Yeah.
Oh, I can't focus. I must have ADHD. It's so overused nowadays.
I know.
Like even me, without paying attention, like, sometimes I go from one thing to another and I'm just like, man, ADHD. But, it's definitely like a diagnostic term.
Yeah, for sure.
Can't use it lightly.
For sure.
So what's one last message, let's say, you would leave to our audience, to our listeners today?
Yes. So what I would like from our listeners is today in today's digital age, there is a lot of misinformation out there when it comes to health information. We have access to internet, looking up information. So what I will ask you is, if you are researching health information, make sure that your source is credible, that your source is reputable, and preferably that it's written by health experts. And also, come see us.
Yes.
Come see your pharmacist. We are your first line healthcare providers. We're here to answer all of your questions and here to guide you. And we also are the medication experts. So we're here to answer all of your medication related questions as well. That's actually why I was motivated to start my social media page, because I do feel like there is a lot of misinformation when it comes to health. And I really wanted to provide valuable, credible information out there for everyone.
Absolutely. Thank you so much for that. And you were speaking about, obviously there's your Instagram page as a resource for valuable, credible information. But are there any other resources you would like to share with our audience? Places where they can actually look for credible information when it comes to health?
So a really good one I like to use is PubMed. It's a scientific database. So it has a lot of articles on diverse subjects. It does use a scientific jargon, however, so it can be a little bit more complicated to navigate. I also really like UpToDate as a resource. For ADHD, I would say the best one that I would recommend is the CADRA.
The CADRA.
Yeah, so it's the Canadian ADHD Resource Alliance.
Okay.
So it not only has very credible information for patients, but also for healthcare providers. We use it very often as well. It has the latest guidelines on ADHD medication, medication updates. And then for patients, it does have some resourceful information to help support them in their ADHD diagnosis.
That's awesome. Thank you so much. Thank you for sharing all of this with us. So you guys, I'll leave all the links down below.
Yes.
Thank you so much for sharing it with us.
My pleasure.
And I'll also share the link of Vanessa's page so you guys could check out her awesome work. Vanessa, can you tell us, tell our audience, share where can they find you actually on social media?
So they can find me on Instagram. So it's at dr.vanessa.pharmd. I post videos and posts. I try to post them every week or twice a week. Again, about diverse health subjects, making sure that I give tips on how to optimize your health. So make sure to give it a follow and a like.
Awesome. I check out your stuff. I really love everything that you do.
I love your stuff too.
Thank you so much. Thank you for taking the time to listen to this episode. I hope it brought you some value. Don't hesitate to share it with a friend, family member that you can see this could help as well. Make sure you subscribe, you share this episode, and I'll see you on the next one.